I'm Brooke, and this is my head-to-toe assessment. This is my patient. He is a 30-year-old male. He is 5 foot 11 inches, and he weighs 310 pounds. Hi, how are you today?
Good, how are you?
I'm good. Today I will be doing a full head-to-toe assessment. The first part of this assessment I will be doing is your head, ears, eyes, nose, and throat. I'm going to start by inspecting your head. I'm inspecting for symmetry, for any lesions, redness. I'm going to start palpating. I'm going to be feeling for any abnormalities. Everything feels symmetrical. Do you have any tenderness?
No.
Okay. All right. The first part I'm going to be doing is your eyes. I'm going to have you, first I'm going to pull down your eyelid, okay? And I'm going to do up, down, up. Everything looks good. Are you wearing any corrective lenses today?
No.
Okay. Next thing I'm going to have you do is look straight ahead for me. And I'm using my pen light to check your pupils. Okay, the next thing I'm going to have you do is follow my pen light with your eyes. Okay, the next thing I'm going to have you do is look at the Snellen chart over there, and if you can cover your left eye and read the third line for me.
REGQP.
Perfect. Now if you can cover your other eye and read the third line again for me.
REGQP.
Perfect. The next thing I'm going to do is check your ears. First, I'm going to palpate. Just tell me, is there any tenderness anywhere?
No.
Okay. Is there any tenderness?
No.
Okay. And then I would note that there is a small skin tag on this right ear behind. The next thing I'm going to do is look inside your ears. I don't notice any drainage or signs of inflammation inside the ear. No drainage or signs of inflammation. Next, I'm going to check your hearing. I'm going to stand over here, and if you can cover your right ear for me, I'm going to say 3 words. I'm going to whisper them, and you just tell me what I whispered, okay?
Okay.
Dog.
Dog. Cat.
Red.
Red.
Okay, then I'm going to come to the other side.
Yellow.
4.
4. Purple.
All right. The next thing I'm going to do is take a tuning fork. I'm going to strike the tuning fork and put it above your head. If you can just tell me if you hear the tune equally in both ears or more in one ear compared to the other.
It's equal in both ears.
Okay.
I don't hear that.
Do you hear now?
Yes.
Perfect.
I don't hear that.
Do you hear it now?
Yes.
Perfect. The next thing I'm going to do is inspect your nose. First, I am going to palpate. Is there any tenderness?
No.
All right, now I'm going to inspect. It appears that your septum is midline, so I want to make note that there is no deviation, and it doesn't appear that there is any drainage. I'm going to look inside. Okay, there is no signs of inflammation or drainage. The next thing I'm going to do is inspect your throat. I'm going to first palpate. This is when I would assess your thyroid. Can you swallow for me? Perfect. Is this tender anywhere?
No.
Okay, then I'm going to come to the back. I'll have you put your head down for me. I'm going to feel your spine. All right, next I'm going to check your range of motion. If you can look up, down, left, right. Does any of that hurt?
No.
Okay, the next thing I'm going to do is use my pen light. I'll have you open your mouth. And I'm going to check your... Do you have tonsils?
No.
Okay, well that makes sense why there's no tonsils. I want to make note that the patient had his tonsils surgically removed. Next, we are moving on to the cardiovascular assessment. I'm going to start with your capillary refill. While I'm doing this, I'm going to check your pulses. You have +2. +2 radial pulses bilaterally. Next, I'm going to check tibial and dorsal. +2 pulses. You have no edema noted. I'm going to check this side. +2, no edema noted. Next, I'm going to check your carotid, making sure not to tear up at the same time. Okay. All right, next I'm going to do listen. All right, and S2 and S1 were both heard, no bruits or no murmurs. Okay, next is the respiratory assessment. The first thing I'm going to do is watch how you breathe for a minute. So I'll just have you sit up and breathe normally for me. And I'm just making sure that his breathing isn't labored and that he isn't using any accessory muscles to breathe. All right, next I will auscultate and listen to your breath sounds. Every time you feel my stethoscope press down, I'm going to have you take a deep breath for me, okay?
Okay.
Okay, I'm going to have you scoot up a little bit in the chair for me. And each time you feel me press this down, just take a deep breath, okay?
Okay.
All right, and then I would note that his lung sounds are clear and equal bilaterally. There's no areas that sound diminished. Everything sounds clear and equal. Next, I will be doing a gastrointestinal assessment. First, I'm going to start by inspecting the stomach, and it appears to be symmetrical. There is no distension, no bowel looping, Next, I will auscultate your vowel sounds in all 4 quadrants. All right, your vowel sounds are normoactive in all 4 quadrants. Next, I'm going to auscultate for arteries. All right, your arteries, the aortic, iliac, and femoral sound great. Next, I'm going to assess the span of liver. All right, and your liver is about 5 centimeters, which is normal. The next thing I'm going to do is have you take a deep breath. And there's no signs of splenomegaly. Next, I will press on your left side and tell me if you have pain on the right.
No pain.
No pain. All right, the Roseg sign is normal and there's no signs for appendicitis. I'm going to just feel around, and then do you have any tenderness?
No.
Okay, perfect. That will conclude the gastrointestinal assessment. All right, next I'm going to check your cranial nerves. I'm going to have you occlude your left nostril for me. And can you tell me what this smell is?
It smells like fish.
Yep, that is tuna, so that would be right. Next, I will have you occlude the other nostril. Can you tell me what the smell is?
Coffee.
Yes, that was right. Next, I will look at your pupils. Your pupils are equal and reactive to the light. Next, I'm going to have you follow my pen light with your eyes, but keep your head straight ahead. All right, perfect. Next, I'm going to have you touch my finger, then touch your nose. All right, next I'm going to have you clench your jaw, open your mouth, close your mouth, open your mouth, close it. All right, perfect. Next, I'm going to touch your head. I'll have you close your eyes and you tell me where I'm touching.
Forehead. Nose. Chin.
All right, perfect. And was that hard or sharp?
Sharp.
Yes. Next, I'm going to touch you with another substance. Close your eyes.
Forehead. Nose. Chin.
And was that hard or soft?
Soft.
Yes. Now I'm going to have you make faces. Can you raise your eyebrows? Frown, smile, puff out your cheeks. Next, I'm going to close your eyes. And can you hear this?
Mm-hmm.
Perfect. And can you hear this?
Yes.
Perfect. Now I'm going to have you open your mouth. I'm going to look in. And can you say ah?
Ah.
Now I'm going to stick this tongue depressor in your mouth and test your gag reflex. Okay, perfect. Now I'm going to have you stick your tongue out and can you move it side to side? Up, down. Now I'm going to have you move your head against resistance. Left, right. Can you shrug your shoulders for me? All right, perfect. All of your cranial nerves are intact. All right, next I am going to tap you and you tell me if it was with something hard or soft.
Hard. 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 Hard.
Yep, and then
Hard. Soft. 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 Soft.
okay, perfect. Next, I will take my tuning fork and I am going to strike it and you tell me when it stops.
Stop.
Perfect. I will do the other side.
Stop.
Perfect. Next, I am going to do proprioception. I will wiggle your toes and you tell me if I left it down or up, okay?
Up.
Yep.
Down.
Yes. Perfect. Next, I will have you close your eyes and I'm going to have you stick your hands out. I'm going to lay something in your hand and you tell me what it is.
Sponge.
Yep.
Pen.
Yes. Next, I'm going to draw a number on your hand and you tell me what the number is.
3. 4.
Yes. Next, I'm going to do 2-point discrimination. I'm going to have you hand me, and then you just tell me when you feel 2 points, okay?
Okay. Now.
Okay.
Now.
All right, perfect. The next thing I'm going to do is check your reflexes. I'm going to have you start with your hand like this. Just hold it out there for me. First, the biceps, then the triceps. First, the biceps, then the triceps, then the brachialis, and then the patellar, all right, perfect. Okay, the next thing I'm going to do is check for meningitis. I'm going to move your head all around and tell me if there's any pain.
No.
Okay, I'm going to have you touch your chin to your chest for me. Okay, negative Burdinsky. Next, I'm going to lift your leg up. Will you bend your knee for me? And is there any pain?
No.
Okay. Next, I'm going to lift it straight up. Is there any pain?
No.
All right. Next, I am going to have you stand up for me. I'm going to have you put your hands out. I'm going to turn that. Is there any pain?
No.
Okay, you want to push against my hands for me? Okay. Next, I'm going to have you come over here and just lean up against the wall. I'm going to check for any winging of your scapula. And push for me. All right. And there is none.